Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. We are live in studio today. Actually, we are almost live in studio. We're here at the Roselle Center for Healing, and we're celebrating Have a Heart Day, but that doesn't stop what we're doing. If you have a problem and you don't know what to do about it, you've tried, you've applied, well, this is your opportunity to find out how to fix it. Call us at 888-630-9625. That's 888-630-WMAL. I'd love to talk to you on any subject. I have a guest today with me here at the office. Guest is one that keeps me straight most of the time and keeps our patients in a good chemical balance, Sue Roselle. Good afternoon.
Good afternoon.
So we're going to talk about a lot of different things, and actually we're going to start the program today by answering a question that somebody emailed to us probably a week or so ago that I didn't answer because I wanted to do the program on it. And I actually called her back or wrote her back and told her that we would do it today. So hopefully she's listening, and if not, I'll send her a recording of the program. But we're going to talk about rosacea, and many of you have suffered from rosacea. Matter of fact, in the general population, there's about 5% or something in the neighborhood of 15 million people that suffer from rosacea. It's quite a devastating thing because it takes away the look of somebody's face. We've seen people with beautiful ivory skin with their skin a mess with acne type of blemishes, and it comes from a very specific format, and we're going to talk about that. We've had success in treating it over the years, and unfortunately the medical approach, the allopathic approach, is the same old, antibiotic therapy and drugs and antihistamines and so forth.
Prednisone for the face.
That's
topical
right.
Prednisone.
Yep, and we end up with major problems because of that. But we're going to talk about rosacea and some other things. We're going to talk about a way that you can increase your strength and your moods and everything else. We'll do that as the show goes on. And we're going to talk about a common food that they're trying to control. Matter of fact, the FDA is taking on Diamond Corporation.
Diamond Nut Corporation.
Diamond Nut Corporation, and we're going to tell you what that's all about. And if we have some time, we're going to talk about the Food Safety Modernization Act, which, in my opinion, is a very double-edged sword that they're trying to sell to you because I think it's a back door to something called the Codex Alimentarius, and we're going to mention that, and hopefully we'll get through all of that, as we never do. But
that's a lot in an hour.
It is, and it's like, we're not there. So this program needs to be 5 hours, and, so you need to call WMAL and tell them that Dr. Tom Roselle Live needs to be not only 3 to 5 hours long every day, but it needs to be every day of the week.
There you go.
And I'd actually get up in the middle of the night to do the program. They accuse me of 6 o'clock in the morning as it is, seeing patients, but, we'll be glad to do that. We're here at the Roselle Center for Healing today, and we're celebrating Have a Heart Day. Many of you are coming in to have complete examination processes, acupuncture and chiropractic exams, for a 501(c)(3) tax-deductible donation to Caring for Others. It's the way that we put ourselves out to try to help others that are less fortunate, who have nothing, let alone the ability to utilize these services. And Caring for Others is a very special organization in that they take administratively at this point nothing. Everything is donated by the doctors that work for them, and it's all given out 100% on an annual basis. So it's a great charity. You'll learn more about that this year because we're getting involved and we're on the board and so forth. But anyway, let's talk about rosacea, Sue, because it's a really important problem, and we see a lot of children but adults as well, right. And it's devastating.
Well, and it's devastating because it's on your face. And any kind of a skin issue, it's right there in front of everybody, and it's a very blotchy red. In more severe cases, it actually looks like acne and has also been tagged as adult acne. Generally, it's involving a lot of inflammation of the skin. It gets bright red, almost like you've got a burn on your skin, but it can also involve eruptions and bumps and things that make it look like you have teenage acne.
As time goes on, too, it involves the nose. It's been our experience that when I've examined patients, particularly as they get older, their nose gets these deep vascular patterns, right. And it enlarges.
Yeah. And it's on the nose, it's on the cheeks. In more severe cases, it can be all over the face, including the forehead and the chin, what they call the T-zone. And to some extent, it does involve the oil flow of the complexion. In excessive amounts, it can cause congestion in the flow of the skin. It can cause blocked pores and things like that. But it's just a combination of different things. Historically, what we have done to deal with it is to deal with the digestion tract.
Well, first, before we get into that, let's not jump into treatment because there's an understandability here.
Right.
Medically, they're going to go after a bacterium, Helicobacter, what they seem to link to this. Helicobacter causes ulcers as well, and erosion of the intestinal system. And their only tool that they use is a high-powered antibiotic. Now, the problem there is that, one, generally they never treat it to completion, but also when you're using those very severe drugs, they totally wipe out everything else.
They do.
Digestive function goes out the window because bacteria is not in place. Your bacteria, good bacteria, and we measure 6 of them when we do any kind of diagnostic for the intestinal lining. That's your support mechanism. That's your immune system. And without that, everything else goes down the tubes.
And on top of that, usually, like I said, they use a steroid topical treatment to decrease the inflammation and the redness. The only trouble with that is it's not going to stay just on the skin. Anything you put on your skin is going to be absorbed into the body. And steroidal medications in any form, whether it's topical or oral or injectable or whatever, again, goes in and causes similar destruction to the good bacteria and the integrity of the intestinal tract, just like antibiotics do.
So what we're seeing in rosacea is an end production, basically, or an external representation of what's going on inside the body.
That's right.
Here's an interesting correlative, because in traditional Chinese medicine and acupuncture, the products of digestive system often end up on the face. For example, if you look at somebody and you visualize the eye and you split the eye down with a vertical line, on the cheekbone, right at the bottom of that vertical line, is the acupuncture point of the beginning of a channel called stomach. And then to the outside of the eye, you have gallbladder. Mm-hmm. And then just a little further down south from that stomach area, on the creases of the smile creases of the face, is the large intestine. And then off to the side a little bit, you have small intestine. So even Chinese knew that so many things show up on the face that have to do with the intestinal tract. And here we have a ugly representation, an unfortunate blemishing of the skin that can last a lifetime.
That's right.
If it's not taken care of. There's a lot of things that cause it. So Helicobacter comes in, but it doesn't come into everybody.
Not to everybody, and there's other factors involved as well. A lot of people are sensitive to normal food substances, such as iodine. Some people are very, very sensitive to iodine, and if they have a tendency towards the rosacea, the iodine could make it much worse. Niacin, which is a natural B vitamin, in certain forms, if you take it in too high of a dose, will cause flushing in the body.
Well, that's one of the reasons. It's the good news and the bad news for some people.
It's the good news and the bad news. It's good for your vessels, but it's not good if you have rosacea, because you already have enlarged vascular support to the skin.
Well,
and that's what gives it the red.
Having said that, though, I don't want to scare any of our listeners in thinking that, oh my God, I'm taking niacin and it's going to be a permanent damage.
No.
It's not. It's not going to cause you any permanency, but it does increase the redness. Niacin is a good thing.
Keyword is in some people.
That's right.
It's not one size fits all here. Sugar handling, another thing. Rosacea is often called skin diabetes, because when people are not processing their carbohydrates, or they're getting a lot of carbohydrates, especially refined sugars, and their insulin levels are not handling it well, that also will cause a lot of this redness and the blemishes to form and causing upset. And that's a systemic problem.
Here you have a situation where we're seeing an external manifestation again from an internal problem.
That's right.
This is not a skin problem, and unfortunately that's the way it's treated in the medical community. It is not a skin problem. It's an internal problem. It's an intestinal tract problem. It's a stomach problem. It's a pancreatic problem. It's the body's inability to produce the normal enzymes, the hydrochloric acid, the pancreatic enzymes, the enzymes that we need to break down bacteria as it comes into the digestive tract to stop it from producing what we call sometimes neurotoxins or endotoxins, and then they're reabsorbed, because at that point the intestinal tract is what we call friable or permeable.
Right.
Things are being digested that haven't completely been digested. They get back into the body, and guess where they go? Into the skin surfaces.
Into the skin. And that's the same for a lot of the different skin problems, whether it's acne or eczema or whatever. it's a topical problem from the standpoint that that's where you see it, but it's more of a reflection of the internal milieu of the body, the balance of the body, and the balance of a person's lifestyle. And it's what they eat, it's their activity level, it's where their stress load is and how well they manage it. So again, rosacea is a manifestation of imbalances within the entire system.
We're here live at 888-630-WMAL. That's 888-630-9625. We're actually at the Roselle Center for Healing, and we're sitting in our office doing a remote live broadcast for you. We're celebrating Have a Heart Day. We're trying to raise funds for those who are less fortunate than most of us so we can bring them the care that they need. If you'd like to call us and ask Sue or I a question, 888-630-9625. We're talking about rosacea and the things that will actually eliminate it. We're going to get into the fix in a few minutes because there is a fix, and alternative methods, integrative care has been very successful. But this, like any other problem, has to be looked at from a holistic triad, structural, chemical, emotional pathway.
That's right.
To be able to turn it back on and to fix it accordingly.
That's right. It's kind of like, your fire alarm going off. All right, you may not have a fire where the alarm is. You've got a fire somewhere else in the house, but the alarm is letting you know something is not working right. And unfortunately, this is a very devastating problem, as are most skin problems for the individual that has to suffer with it. And again, it's an imbalance that we have to look at and go after from a number of different angles in order to help get some improvement in that.
There's a whole list of things, and obviously we're not going to talk about the medical fix here because as far as I'm concerned, it doesn't work. You knock out the intestinal system, and now you have other problems.
That's right.
You knock out the good bacteria, nothing works. And that's critical because now you become more sensitive to all kinds of allergic responses in the body when you don't have those digestive enzymes. And things are reabsorbed. Your toxic levels go up. You end up having other skin issues because of that. And
and that's the problem, too, is a lot of the skin problems are dealt with by low-grade chronic use of antibiotics. And that just whittles away at the basic essence of your life because it's interfering with how your intestinal tract works. It's interfering with how well you process your nutrients. It leaves you open to allergies, like you said, because antibiotics ultimately will cause disruption of the barrier function of the intestine, meaning things that normally would not have gone into the body because the intestines were strong and holding them where they belong until they can be eliminated, are now absorbed back in.
Well, when you think about the preponderance of antibiotic therapy, not only a doctor to patient use, but putting in animals.
Oh, yeah.
And then people don't realize when you inject an animal with an antibiotic or a steroid or a growth hormone to get it to marketplace to do preventative, when you eat that meat,
you're getting it.
You're getting that stuff. It's going into you. So now you have not only all the antibiotics you've had all your life, but you're also getting it from the animals. That's why eating organic is so important,
That's
but
right.
truly organic.
And that's why we go back to organic wherever you can, particularly in the animal products. If you can't afford to do anything else in your diet, try to get free-range, non-antibiotic, non-hormone injected animals.
Sue, we've got to take a break. We're coming up to some very important messages, and we'll be right back. Remember, we're here with 888-630-9625. That's 888-630-WMAL.